Are chatbots helping or harming our health? Here to break it all down is Dr. Sheila Wijayasinghe. Welcome back to the show.
So good to have you here. Okay. So Dr. Sheila, listen, I have a lovely GP and she's a wonderful person, but anytime I sit in her office and start a sentence with, yeah, so I was feeling this way and I went online, I see the whole, her life drain out of her eyes. And I know, according to the statistics that I just read out, a lot of people are doing this. So what are you seeing in your practice?
A lot of people are using the chatbots to get assistance with their health. We know that 2/3 of Canadians are using AI in some form, not just health-related. The Canadian Mental Health Association came out with an interesting survey recently that showed that 10% of Canadians are using AI chatbots to help them with therapy or with support. People have always looked up things before coming to see me in the office, using search engines, talking to family members. This is a different level, though, and it's really important to understand the risks and the benefits so we can stay safe if we're using them.
Okay, so you as a doctor, are patients being upfront with you? Are they telling you they're using chatbots, or can you just tell that they've been online?
Yeah. So instead of saying knee, they'll say my patella hurts, or I have a sebaceous cyst, and I'm like, oh, you mean they usually used to say bump, and so people are not always telling me that they're using it, but I can tell because of the patterns of their language have changed a little bit. I actually really appreciate when families tell me that they're using chatbots because it helps me understand what they're coming in with. We can address it fully. And recently I had a family come in and they're like, we're really tired. We know that your time with us is limited. We want to organize ourselves before coming in. We used a chatbot. It helped them. And so in that situation, it can be helpful, but it really is an educational tool, not one that's going to make clinical decisions for you.
Right. Okay, well, with that in mind, some recent studies have shown that ChatGPT can actually pass medical licensing exams and solve clinical cases more accurately than humans can. Wow. So this is a bit frightening, but not imagining the apocalypse when it comes to these taking over. Can you talk about ways in which these actually may be, in fact, helpful?
Yeah, so I do see that quite a bit. I wouldn't want to go up against any chatbots in any sort of medical exam because they have a huge database that they're pulling from. And so there are situations where it's helpful where, after a visit that you've seen someone and it's confusing, it can help decipher sort of some of the medical jargon that we've used. It can be helpful to summarize results, prepare for visits, and also think about it from an equity perspective. We have 6 million Canadians right now who do not have a family doctor, and they live rurally or in areas where they're not getting access to care. And so if you're using an AI tool that actually is taking from validated resources, it can be helpful in those ways as well.
Okay. Well, as we move into the future and talk about using AI and technology even more, what are some of your main concerns about using chatbots for our health issues?
Yeah, so chatbots, if you've ever used one, you know how confident they are with their answers. And there's something called AI hallucinations where they will tell you something and it's actually not true at all. And so I can tell that because I have a medical background to say that's not true, and sometimes it's answered to me and said, oh yeah, you're right, it's not true. So we have to be careful with the information that we're putting in and taking. It can miss follow-up questions, so AI is very good at answering questions, but not necessarily doing the follow-up questions, which is what I do in the office to create nuanced experiences for my patient to make sure that we're addressing things that is personalized to them. The big ones are around fear escalation, so they can give you a list of diagnoses. Patients come in and they're like, I think I have the big C, I have something else, and you worry, and it may not be applicable to them. And finally, the big ones are privacy. And so in healthcare settings, we have huge privacy regulations. And on AI, it doesn't have those same regulations. So you worry. Some of my patients have been putting their photos up, putting their kids' photos in because they're worried about something infected. And so that's something that be careful what you're putting on there because it goes into the large database. And also the climate and environmental impact of AI is something that we always have to be aware of. And finally, in terms of equity, again, the data set that it's pulling from is biased. And so racialized individuals, people living with disabilities, gender diverse individuals, women, our stories aren't always represented in medical databases, and that is also the information that you're getting. So things can be missed.
Right, it's true. Good point. Okay, so listen, we should understand where things go wrong so that we can have maybe a healthy approach to this. So where is a time that a chatbot gave faulty medical advice and then it caused some real harm?
Yeah, so there have been stories of this happening. About 1 in 5 people have said that there's been some delays in diagnosis or misdiagnosis by these chatbots. So you have to be careful again with the information that it's giving you. In terms of mental health, that's the area that we're seeing some concern come up with AI chatbots. Specifically, there's a condition called AI psychosis, where the line is blurred between reality and what's AI. And that can be, especially for people who are vulnerable, we have to be careful. If you have a mental health condition, we have to use some caution. And also there's been some situations where AI has given instructions to people where they've asked around like, how do I complete a suicide? And those are very serious situations, and they're working on that to like safeguard those systems. But those are, that's an extreme situation, but I want to mention it because there are risks again to these tools.
Yeah. Wow. I mean, I imagine in your office you're meeting people or coming in. Like, can it be challenging if you have a person who's consulted with a chatbot and very convinced of the confident answers they received to tell them that that's not accurate?
It can be very challenging. I mean, hopefully you have a decent relationship with your family doctor or your nurse practitioner to be able to have a back and forth conversation. But these chatbots are very convincing. And they also have very good bedside manner in that they're very affirming. So they tell you sometimes what you want to hear. So you have to have that skepticism to be able to understand. And my goal is really to have that nuanced conversation to make sure that it's personalized to you. And then we navigate those conversations.
All right, so say somebody's watching and they are determined to use a chatbot to go over their health issues. What advice do you give that person?
So always be aware of the privacy issues. Be careful of what you're putting out there because that is going to be taken into their database. You have to be careful with that. You always want to ask open-ended questions. Use it as a tool to prepare yourself for visits, not something that will be making the decision for you. Always ask for the sources because you want to know, are these real sources or not, and validate any of the answers that it's giving you with an actual healthcare provider so that we can always reassure you because there's so much information out there and it may not be applicable to you.
Okay, so this is a big question, but overall, do you think that people using AI and these chatbots has been helpful or harmful, at least in the context of you as a family doctor?
Yeah, it's a mix. Listen, I think we again have a healthcare crisis where people don't get access to healthcare and their doctor and nurse practitioner, and that's really challenging. And so I think people are using this to be able to advocate for themselves and understand their bodies more. So there's a benefit to these, but we always have to find that balance. In medicine, we're using AI quite a bit within our offices. Like I use an AI scribe with permission from my patients. It has decreased my workload by an hour every day because my paperwork is streamlined. So there's benefit to these tools. In image-rich specialties like dermatology and radiology, they're analyzing these pictures and doing a really great job with it. And so there are these streamlined ways that we're using AI. There's good AI tools that are using good resources, but we always have to keep privacy in mind and the safety of our patients in mind whenever we're using something new because it's evolving rapidly.
Unbelievable. Such a fascinating conversation. Thank you, Dr. Sheila. Wow. All right, use with caution.